Hi, I'm Mel Hartman, and today we are talking about pee. More specifically, we're talking about using first morning urine versus second morning urine when testing for pregnancy. Now, I have a very strong opinion about this, and my opinion doesn't come from forums or packaging or all those sources that seem to be everywhere saying first morning urine, use first morning urine, it's the most concentrated. So yeah, it's the most concentrated in terms of uric acid because it's like the darkest. It's maybe the least dilute with water, but I do not believe that it is the most concentrated in HCG. And when we're testing for pregnancy, that's all we care about. We want an HCG level that is going to show those two lines because that's what we're here for, right? I mean, if you're here, you want to be pregnant. So you want to see those two pink lines. Now, my background in terms of where I came to this conclusion comes from my work as an ICU nurse. In the hospital, we have very strict protocols when it comes to testing urine for either hormone or medication concentrations. The first thing we would do, well, especially in the ICU, it's super easy because all of our patients are comatose, and usually we're collecting their urine in a bag via a catheter. So if we needed to, say, check a medication concentration in the urine and it was scheduled for noon, what we would do is at 11, we would empty the bag of all the urine, and then we'd know that any urine collected between 11 and 12 was what we were testing. So that urine would be the most accurate representation of the patient's medication concentration level at 12 o'clock, if that was the time that we needed the level for. So in the same way, I think it's really important that we test second morning urine instead of first morning urine. And to kind of give you a bit of a visual of exactly what the difference might be, I have designed this little experiment for you.
Welcome to my bladder illustration. Over here we have little cups, each representing an hour of time from 10 p.m. all the way until 10 a.m. This water represents your kidneys. You're welcome for not using real pee or even yellow food coloring because that would have been gross. The blue food coloring will represent the HCG level in your urine. I mean, not the greatest, but that's what I got. All right, so first I shall place some of this water urine in each of these cups. Now I'm going to be putting a little bit of the HCG in each of these little hours of pee. You'll see that I'm putting less toward the beginning of the night and more as I move along. This is because as you sleep, the HCG level in your blood and therefore in your urine will be rising. Now, it's not going to be terribly dramatic as much as this, but it's enough that the urine from 10 p.m. and the urine from 10 a.m. might be the difference between a negative and a positive pregnancy test result. All right, so this is the FMU bucket. This is your bladder after you have been sleeping all night. So it includes the pee from all of these hours, and therefore I am putting the pee from all of these hours into your FMU bladder. Okay, fine. You're going to get up at 6 a.m. I've decided. All right, bladder full, FMU, that's the concentration. Now for SMU, it's only going to be, let's say, the next few hours of the morning. You've peed once, now this is what's kind of left. And I didn't quite mix the hormones in very much, so it actually would be darker if I did this properly. Now I have to make sure that we're testing an equal number because we're looking for concentration. So we have to remove all the variables. Over there, I am going to remove some of the urine without changing the concentration so that the amounts in each of your FMU versus SMU bladders are equal so you can actually see the color difference. And there we go. You can see here that the FMU is paler than the SMU, indicating and illustrating that it is a better urine to use if you want to test more concentration of HCG.
As you can see, the bucket with the second morning urine was more concentrated than the first when we adjusted for volume. This is exactly what I'm talking about. We want more HCG in our urine, and the best way to do that is to purge your night pee that is all averagey and take only the freshest, newest pee. So, go pee in the morning, go about your morning. Maybe you don't have 5 glasses of water and 3 cups of coffee. Maybe have a glass of water or a decaf coffee. And then an hour or two after, take the test. See. Or if you want to be even more scientific about it, do both. take the test with your first morning urine, and then do like I said and take it with your second morning urine, and show me which of your test results are darker. I hope this was helpful to you. I just love talking about all kinds of trying to conceive and pregnancy stuff, so come back for more content on this and other family sort of topics. Thanks for watching.